My name is Shale Abdi from the Department of Health, Garissa County, the County Health Record and Information Manager, largely coordinating the activities of related to health information system and data management. So my role largely at the county level includes providing and support to the sub-counties. That basically involves training of the sub-county managers to ensure that they get all the necessary information for the TCV as well as the measles campaign. And then the other component that largely do at where I sit is ensuring that we have adequate monitoring and the data for decision making is available both at the sub-county level, at teams levels as well as the county level, and ensure that the data that is done for the campaign is submitted on daily basis to the higher levels, that is to the national for regular monitoring of performance at all levels. Garissa County is one of the counties that is being planned to participate in this campaign. And before we started the main activities rollout for the counties to the national, there are many strategies that was put in place through the leadership of the director and the chief officer of the CCs. One of them was to plan for coordinations with the sub-county levels, that is communicating to the sub-county levels, informing them in terms of the upcoming MR as well as the TCV campaign, so that all the facility levels at the sub-county levels and the county management teams are aware of. And then we also had engagement with the partners to ensure that they are aware of it, and then arrange for local support where the funds that will be received from the national may not be available. And then we also, and one of the other strategies was that also to put in place other mechanisms to prepare the all levels in terms of informing the county leadership and in terms of through the CEC for health, informing the governor and the other executive, informing them in terms of these upcoming campaigns, and ensuring that we get the maximum support in terms of political as well as other areas. And then also coordinate with the national MOHs to ensure that we receive the logistics in time for transportation to the facility level as well as the sub-county level, and then preparing also to receive the vaccines in terms of cold chain management at facility level and at sub-county level, and they have the necessary parameters or equipments to manage the larger stocks of vaccines that is expected to receive in the areas. And then in terms of through the health promotions, also to do advocacy and communication so that the community as well as all the technical health workers are aware of it through the community health volunteers as well as our community units. Largely what happens is for EFI, and there is a routine system that is normally provided through the immunization systems where any suspected cases are normally reported from the facility to the sub-county and then to the county and then to the nationals. And the expectation is that we will continue that systems during these days of campaign. And then the normal monitoring tools that is done on daily basis on the campaign has a component where we capture the AEFI that will be reported by the facilities as well as the teams, supervisors, as well as the vaccinated for one transmission to the next levels. So that is the system that is used for the AFI and for a normal routine immunization services as well as the campaigns that will be provided. So before even we plan for this campaign as a department, we normally map sub-counties that have the lowest immunization coverages. And once we map those lowest coverages, we also do a mapping at the sub-county level, the facilities that have the lowest immunization coverages. And if you look at it, our routine data, you will find that we have largely and majority of our sub-counties having low coverages immunization that have not achieved the desired 90% coverages for immunization. So as a county, even before the campaign, and that we normally do it on quarterly basis through the performance review meetings, it happens that we have identified many times in terms of this facility that have the lowest immunization coverages. And deliberate efforts are normally done to support them either through outreach services or in other support to ensure that we reach the children that have not been reached through the routine immunization systems. During the campaign, you will not find few spot cases in terms of hesitancy. And if that is found, then it is handled through the healthcare workers and as well as the sub-county managers to support and talk to the household level or a community level individually to convince them. And once they talk to them, they normally accept it. So, and then we also have other immunization champions that is identified within the county that we normally use it. Garissa County shares borders with Somalia, and we also host the largest refugee complex in Kenya, which we refer them to the Dadaab refugee camp. And this refugee camp, we have almost over 400,000 population. And on daily basis, you see people coming from Somalia or in other countries coming to the refugees. So we normally do routine screening for children under 15 years to confirm their immunization status. However, if you look at it, you will find that over 90% of the children that come to the refugees as new entrants are 0 doses. And because the border is closed, you will find sometimes not passing them the designated or areas for screening to get immunization. So they will end up to their relative at household levels and probably be identified after some time through the community health volunteers that they are provided immunization and then linked to the next health facility to complete their remaining schedules. So we had that gap, and if you find it, Garissa is one of the counties that always becomes hotspot in outbreak, either polio, either measles, and largely from the refugee camps due to the many of the 0 doses that are coming from our neighboring countries. And this is a population, this long porous border that is closed and cannot be controlled. So on daily basis, you will find that these are the things that come. However, when they come to the refugees through the refugee and implementing agencies and UNHCR do their best to ensure that these new arrivals get the necessary doses for children under 5 years in terms of immunization, as well as specifically targeting the children under 1 year to ensure that they get all the doses remaining. And the Garissa Health Department through the ENVI provides the necessary vaccines to ensure that we don't miss the gaps that existed in the immunization. So far, we are according to what we call the communications and the Dadaab refugee camps. We have 4 camps. All the 4 camps are participating in the campaign, and they will benefit in terms of the measles, MR, as well as TCV. Just like the polio, we have not missed them. We treat them as part of the population within Garissa County, and discussions and communications are normally shared through the national MVIP to consider that, and we didn't have any challenges in terms of that. So they are participating as part of the communities that will benefit this campaign. So one of the lessons that we largely learned is that to improve efficiency in our upcoming campaign is early planning, a very important component, and early coordinations to ensure that we don't do things in hurry. The other lessons that we learned is that in the polio campaigns, you will find that logistics arise late. in terms of providing the provisions on time, in terms of supplies, will also ease the burden in terms of transportation, because in Garissa County, and the distance between the county headquarters and some of the sub-counties are very far, and these are sub-counties that do not have tarmac roads. They are using all-weather roads, which requires a long time of travel and tiresome. So early arrival of these logistics and timely distribution of these logistics to sub-counties and then to the sub-counties facilities will also be a very good thing. That has one of the lessons that we learned. And then the other component that I think learned was that, and it is important that we had early engagement through the communities. That it means giving the communications to either airing the upcoming campaigns through the radio spots, the local radios, FMs, or even communicate to the necessary community health volunteers, CHPs or promoters, as well as the other government ministries or line departments within the counties, so that they also play their key roles in terms of ensuring that they do the same, like the Ministry of Education, internal security. So these ones will also be very useful if they are communicated on a timely basis, and engaging also and doing these trainings in early. So my message to the larger community is that immunization is one of the strategies that is used to control vaccine preventable diseases, and they need to embrace, take our immunization either through the routine services or through the campaigns. Largely, one of the things that we also request our communities always is to use our health facilities, specifically not for only campaign but for during the routine immunization. These campaigns are only meant to fill the gap that the routine immunization could not fill. However, if you could have our community accessing and our health services through our health facilities, either public or private, that are providing immunization, and they take their children under 1 year to receive immunization, then we couldn't have campaigns and we could have high coverages. However, our coverages are low, and that's why we have campaigns, and we have outbreaks because we have many susceptible children that have not received their immunization. So my message to my community is let's take immunization. It's a safer method. I can remember when I was in primary, I still got immunization. I'm still moving off it. So there's no harm in terms of taking it. And these immunizations are always available, especially for routine in all public and private health facilities throughout. And then during the campaign, they will also available at the facility level. They'll be available at mobile outreaches. And then we will have a static, where that means probably people bringing them into one place, giving them the vaccinations and a shade or so, and then moving it to another place. It's not possible to do house to hall, but that is it, mobile, static, and then temporarily fixed spots where the campaigns will be and the strategies will be used. However, the most important for the public is to utilize the routine immunization services that is provided on daily basis in all public and private health facilities. First of all, we want to thank the government of the National MOH for picking up these campaigns. Specifically, I think Garissa, last year, I think from January to December, we had an outbreak of measles for 12 months. And I think this campaign will become handy in terms of it. However, I also want to challenge the government that we want to invest in campaigns, but we rarely invest in routine immunization. So the best strategy to help the community and the public of this country is to invest in supporting routine immunization on quarterly basis or monthly basis to ensure that all our eligible children reached get the vaccination of children under 1 year, and let's strive through the government as well as any partner to ensure that all counties and all sub-counties achieve the 90% coverages of immunization. Until we do that, then we will still be struggling with these campaigns, which is huge, costly to do it. And I'm sure if you look at the resources that you use for the campaigns, if you use for routine immunization, will have more impact compared to a one-time off for campaigns that will largely treat. And then the other component is Garissa is one of the counties that hosts the refugee camps, and this is a very complex population. If you look at it, and immunization, they accept it, but these are people who are refugees. They have other priorities, and they travel long distance to come to the camps. And I think it is also important that the other related national government parameters also engage the other government to ensure that they also play their other roles, like ensuring that these camps have the right sanitations. You will find that these vaccine preventable diseases are spread from other modes. So having the right sanitations for the camps, reliable water sources, and ensuring that all our populations in the refugee get the necessary will also be one of the things that will help us to improve services for this county.